Hi, my name's Fadi, and today I'm going to be discussing a scoping review on child abandonment and institutionalization in the Maghreb. So, the Maghreb is historically a region in North Africa, and the reason why we chose to focus on this region is routinely countries in the region are grouped together under the title of Arab speaking, Islamic speaking, or MENA, MENA standing for Middle East and North Africa. Um, and the reason why we didn't focus on the larger region and rather this is because these countries share an Amazigh and recent colonial history and also a Sunni Islamic background. Mauritania with that history is very different to Iran, who are Shiite, don't share that recent colonial history and speak Persian or Farsi, not Arabic or Amazigh. So focusing on these countries allowed us then to really hone down what we were focusing on and looking at. But there's also a shared high rate of reported institutionalization of children, which can impact a child's development and mental health. But there's also high unemployment and high reported rates of rural to urban migration from climate change. And there's also stigma to people living outside of traditional nuclear family norms. But there's also a lack of contextualized support and cohesive child protection systems in the region, which means institutionalization is a lot of the times the only recourse for children who are in danger. So our aims of our scoping review was to estimate the prevalence of the number of children in institutions in the region, but to also understand what the different components of the child protection systems are in the region, and if there was any space for cross-regional learning, where one country may have had similar experiences and be able to overcome them, and this would help us inform future research. So we searched for articles from 2021, in 2021, from the years of 2010 and 2020. So we originally identified 962 documents, and through our inclusion and exclusion criteria, we ended up including 57. We drew on the systems framework to understand the components of the child protection system in the different countries we were in, and this ensured we were able to use the same analysis for all the different countries and for the region as a whole. So our first area of results was to estimate the number of children in institutions, and this was very difficult as there was limited resources available, and different countries and different institutes and different organizations have different ways of classifying an institution. Libya and Mauritania were difficult to get numbers for, and while they seem like they've got the least number of children in institutions, Libya, for instance, is going through an emergency crisis at the moment. So that 15,000 number is only the children reported in the UNICEF camps for unaccompanied minors. Mauritania, while that seems very small, this was only the number of boys living in Dar Talibs in the capital, and didn't include something like the 500,000 child slaves that are born into hereditary chattel slavery in the country. Tunisia as well, while it seemed to have the highest rate, it also had the highest number of state-run institutions. But what we can take from this is it's the equivalent of 1 of every 30 children in the Maghreb who have experience or will experience living in an institution. The larger part of our results was understanding these different components of the different countries. So the purpose of the normative framework of a child protection system is about who the child protection system is looking to support. Is it the child? Is it the family? Is it the community? Is it the state? So all the countries share in that Sunni Maliki background, which means usually it's the family at the cultural and social level, as the child is considered within the family and under the authority of the father. However, Tunisia and Mauritania had a child protection code, which really did place the child's rights at the forefront of legislation. But Libya was a bit behind here, where it's more concerned with reacting to emergency responses. The structures in place were muddled, so there wasn't really much separation between religion and state. And as we said with the normative framework, Sharia really influences all facets of legislation. But there's also different functions within different child protection systems. So as Tunisia and Mauritania had a legal child protection code that gave child protection officers authorities to cross between institutions, Morocco and Algeria didn't have that, so it meant there's lots of competing stakeholders and purposes. But all the countries did share a lack of frontline implementation of those national policies. All countries shared a limited capacities in human, financial, and infrastructure resources, but there's also a limited continuum of care, and what this refers to is prevention measures and how it can keep supporting people. So there's limited social security, and there was a kafala system, which is an Islamically prescribed way of adoption for children who have their birthright relinquished by their parents. So there was nothing other than kafala available for older children or for parents who wanted to keep their children but not relinquish their birthright. Tunisia was the only country that had legislated foster care. The process of care in all these states, as I said, when we have competing stakeholders, a lot of children fall between the tracks. So it's very hard to follow that process of care for children from prevention, detection to response. All countries have reported to the CRC within the last 5 to 10 years. However, there is no transparency in reporting mechanisms, so there's no all-encompassing child protection database that is reported on. So what we can take from all of this is Tunisia really sets the benchmark, and this was pre the most recent political difficulties in the region, but it really shows how Islamic legal traditions are malleable, and it really positions child rights at the forefront of its legal codes and laws. Kafala and foster care in the country have been able to be complemented, and they were able to develop a child protection code and legalize premarital sex and sex work. Morocco and Algeria are very comparable with a high number of children that they have in institutions, but also that they have competing actors and competing stakeholders, and they lack a foster care system. So there's a lot that they can adopt and adapt and learn from Tunis. Mauritania provides a blueprint for Libya in a way where it's been able to do a lot through its mapping exercises, which were really community driven. And this is not just for Libya, but I think all the countries we found can share from adopting community mapping exercises to understand those different components and sectors and bring them together. However, Libya and Mauritania still face everyday challenges. Mauritania with everything attached to child slavery, and Libya with the emergency crisis. Thank you so much for your time. And if you have any questions or comments, please feel free to contact me. Thank you.